All right, so today we're going to be doing a surgical cricothyrotomy. So before we do that, give a couple of things of information. The reason you would want to do this mainly would be because there's you would do this after you failed 2 intubation attempts. If there's angioedema to the face, if you can't get air in from above like the epiglottis, and a supraglottic airway doesn't work, that's when you would want to do a surgical cric, and you need to get air in now. Contraindications would be you're able to use a supraglottic airway instead, you're able to intubate instead. This is kind of a last resort type deal. Some special considerations would be like for children less than 12, between 12 and 8, depending on your protocols, you might be able to do like a 14 gauge and do a needle cricothyrotomy, but it all depends on your procedures and all that. But really, under 12 years of age, you don't want to do a surgical cricothyrotomy just because of the airway for them is smaller and there's a greater risk of causing some severe damage to it. And then some possible complications would be there's blood there as you're doing it, and for that you just probably want to have maybe suctioning. There shouldn't be a whole lot of blood if you do it correctly, but there could be blood, so you'd want to have suction there just in case. So to begin, you would take your hand and then you would pinch and you'd kind of work down the cartilage here until you kind of found that gap, also sometimes referred to as a bouncy trampoline. As we're doing this, we would also have on the appropriate PPE because of how invasive it is, and anytime you treat a patient, you should have appropriate PPE on. So once you find that trampoline, you would grab your scalpel, you would extend the blade, so holding kind of pressure on there, you'd poke through, you'd work it up, and you'd work it back a little bit, opening up that airway. So once you've got it like that, you'd want to close your scalpel and then push this in, kind of open it up. Take the skin hook along the edge of it to kind of pull back on the skin so you can really get in there to open it up. Once you've got the skin to open up, you'd want to poke through the cartilage and open that up. Once you got that opened up, you can set that off to the side. You'd take your tube here. I've already tested the balloons on it. You'd want to make sure it's tested so that the balloons inflate correctly. And then you'd insert it in, remove your skin hook. You'd inflate the balloon, remove that, still holding on, remove this, attach your BVM to high flow O2 and then attach it to here. Give a couple breaths, check in to make sure you have good chest rise and fall. I'm gonna have my partner take control of that so I can continue to hold on as I secure this airway here using this provided strap. The strap would come down around under the neck or head. Our guy doesn't have a neck or head. So that's probably why we're doing a cric instead of an intubation, is because he has no head. So bring it up. And now that it's secure, you can let go and you continue breathing. Probably attached to some monitoring, SpO2 and tidal, just to monitor to make sure. You'd listen to lung sounds, make sure they're clear, and that is a surgical cricothyrotomy.